Welcome back to the show. Healthcare, it's extremely expensive. People are super frustrated with it. People have to wait a long time to get into their doctor, especially when they're not feeling well. So, what's the solution? Let's get into it. So, I don't have to tell anybody that's listening to the show today that there's a huge issue when it comes to healthcare, and there's a lot of frustrated people out there, and it's really expensive, and so on and so forth. But what I can tell you is that there are some doctors that are getting a little bit creative in doing something a little bit different that people don't really know about. And it's called direct primary care. So this is exactly what it sounds like. Direct primary care. It's a primary care physician that has his own practice, but he doesn't take insurance. It's based on a membership fee. And oftentimes it's very reasonable. And it's something that you can sign up. And here's some of the things that are really neat about the way that they have set this up. It allows them to take a smaller amount of patients, right? So they can actually spend more time with them and be able to deliver a higher level of service. And I don't think that a lot of people know about this because they're generally trained that, hey, if I get sick, I have my medical insurance, who's in the network, I call my primary care. But one of the biggest frustrations is that when you call your primary care, they're like, well, we don't have an appointment for 3 weeks or 4 weeks or 5 weeks. And when you're sick or you're not feeling well or you need to be seen, that's not really an option. You need to see somebody either that day or you need to see somebody the next day. And it gets extremely frustrating when you don't have that access. So a lot of people end up utilizing urgent care because it's available and sometimes you have wait times, so on and so forth. And who really wants to deal with that because they're not feeling well and what they need is to be seen and taken care of. So direct primary care is exactly what it is. It's a membership-based service. So you are able to oftentimes get same-day appointments or next-day appointments because the doctor is setting this up in such a way where he can give you a higher level of service. And oh, by the way, it's not going to be that situation where you're going into the doctor and only spending 6 or 7 minutes because they have to be able to see 6 to 8 patients an hour, right? To make everything work for them. This is an opportunity to be able to spend 30 minutes, sometimes up to an hour, to really talk about what's going on in your health or what's going on in your situation to be able to build that relationship with the doctor so you have them available when you need them, when something comes up, or better yet, when you actually want to put a plan together for your overall health. So this is something that I utilize. I do have insurance and I utilize that for my catastrophic needs or if I have labs or tests or so on and so forth. But I also pay the membership fee for me and my family to be able to get that higher level of access of care because I'm more interested in thinking about the long term and building that relationship with my doctor and be able to see them or call them on the phone or send them a text message when I'm not feeling well or I have something going on. And I think you'll probably see more and more of these pop up in different markets because I think from the doctor's side, they're kind of burnt out on the traditional model, right? They don't want to have 5,000 patients. Maybe they only want to have 500 or 600, which this model enables them to be able to give a higher level of care and build a practice that really makes sense. It's definitely a different business model, but I can personally say that it really works for me. It works for my family. I know that there's several people that opt to do this because they want to have the availability of their physician and they want to make sure that when they're going in, they're not seeing a different doctor every single time. And when you have a primary care physician, the whole idea and the premise is they're supposed to get to know you, your medical history. And the idea is that you're going to continue to be their patient over a period of time. So whatever it is that you're trying to accomplish, or if you have a health issue, that they're going to be the ones that you're talking to. And in this day and age, that's generally not the case because if you want to see that primary care doctor, a lot of times you're going to have to wait to see them. And if you can get in, sometimes you're seeing someone else, another doctor, a physician's assistant, nurse practitioner, whatever that is, but you're kind of seeing a different person every single time. And if you're going to an urgent care, then you're definitely seeing something different. So I think a lot of people are getting more and more astute to the problems that they're facing, especially when it comes to their doctor. And, if you really think about it, this is kind of the way that medical was done. I mean, you can look back in history and, you had a small town, you had Dr. So-and-so that was there and that's where everybody went. He's the one who took care of your primary care needs, right? Your overall health, you saw your whole entire family, right? Maybe your parents, so on and so forth. And it was a fee for service and wasn't necessarily that traditional insurance model. And I'm not saying that there's anything wrong with the traditional model. I just think that it is an underserved option for most people, especially if they're looking for more from their healthcare healthcare and more of a relationship with their doctor and giving them that ability to be able to subscribe to something and have that access. Now, the main difference is they don't take the insurance, right? They either opt for direct monthly payment, right? Or they take insurance. I mean, that's the major difference. So in being able to do that, that gives them a much better business model and it's much more functional. And a lot of times you're going to get the care that you like and it's not going to be so rushed and you're going to have that ability to utilize those services the way that you want to utilize them. And those are the things that I think are one of the benefits. And as a matter of fact, in a couple of weeks, we're going to be interviewing a doctor who's opted to go this model, and he's going to dive down a little bit deeper on why he chose to do this, not only as a business opportunity, but for him to be able to serve his patients better because he was getting burnt out on the fact that he could only spend 6 or 7 minutes. And to him, that wasn't enough time to really be able to dial in what's going on. So I always think that have to look at what's available, and this may be available in your town. You can look it up. You can type in direct primary care and see if it's available near you. And it might be something that you want to take a look at and research, but it is available. It is something that's going on right now. I think you're going to see more and more of these pop in given the current state of affairs with healthcare. And I think people are just looking for a higher level of service and they just feel more cared for if they could actually sit down and talk to their doctor and tell them what's going on. So if you know someone who would be interested in learning more about this, I highly encourage you to share this episode. It's good information. If you like what you heard today, subscribe. And if you want to learn more, you can find us on YouTube at HeyCharlesBiz and on Instagram and TikTok at HeyCharles77.